Hi everyone, Haley Walker, hearing care specialist with Hearing Solution Centers, here today to talk with you about what to expect when you get new hearing aids. So, we hear a lot from patients that they think hearing aids are going to fix their hearing loss or make their hearing perfect again, but unfortunately, that's not true. So, when we have hearing loss, those hair cells in the cochlea, once they're dead, there's no restoring those. Hearing aids are going to help us to restore some sounds and speech that we've lost, but it's not going to make it to 100%. What patients also can experience when they get fit with new hearing aids is that they feel like their own voice is too loud, or they feel like they're talking in a barrel, or it's echoing back. So, there's two reasons for this. And the first is because we have the hearing aids in. We're getting much more sounds and speech, and definitely our own speech, much louder than what we did before. We also have hearing aids in our ears, so we're plugging ourselves up a bit, which also causes an occlusion effect, makes our own voice sound much louder. So, over time, our brain is going to recognize that it's us and eliminate that for us. We're going to sound much more normal, but again, when we get it, it could sound too loud, not just our own voice, but all sounds. And same thing here. We need to let our brain readjust and retrain to the new sounds, not only our own voice, other speech, but little sounds, car blinkers, refrigerators, those little sounds that we really haven't heard in a while. It's going to take our brain some time to recognize those sounds and identify them for us so that we feel like we're hearing much better. It can take a while to feel like those hearing aids are working appropriately for us, especially if it's been a while without hearing aids. So it can take a few appointments to get our brain readjusted and our hearing aids adjusted to where they need to be to help us hear better in all environments. We also hear from patients that they believe that hearing aids can be an instant fix or they work immediately and they don't need any maintenance or care. And again, not quite true. So it does, like we've talked about, take some time for our brain to get readjusted to those hearing aids, but it also takes our own practice to be able to put them in, be comfortable with the sound setting. So it's not just our brain that needs some practice and some work, it's ourselves as well to get used to a new a new device, a new tool that we're utilizing to help us. Those hearing aids also need some cleaning every so often, about once a month, but we like to see patients about every 6 months to ensure that those hearing aids are working appropriately for the patient. Sometimes it can be hard to tell when something's broken or not working if we can't hear if it's not working. So making sure to see your provider to ensure your hearing aid is not only just clean but functioning properly for you is going to be your best case scenario to achieve long-term hearing goals. And that's just a few things that we can expect when we get new hearing aids. So make sure to reach out to your provider for adjustments and appointments, retrainings on how to clean the hearing aids if needed. Thanks for watching. Have a good day.